Welcome to another LJ screencast. Today is on treatment of common injuries and the kind of symptoms and duration of the treatment. So let's begin. So first we'll talk about simple fracture. Well, this is a break in the bone which causes little movement to the bone placement. Kind of signs and symptoms you sort of can look out for is obviously severe pain at the site of fracture and loss of movement. Also swelling and possibly a bit of bruising around the point of fracture, and also dislocation. The potential cause for such an injury is poor technique, something like tennis where the arm is used incorrectly, or excessive impact in collisions such as a scrum in rugby or rugby tackle, or just a common fall in sport. Right, so how would you treat a simple fracture? Well, first of all, it's dependent on the site of the fracture and also severity. Obviously, medical attention is used, and in severe cases, an ambulance may be needed if it's on pitch or something. Price, protection, rest, ice, compression, elevation is used. Mobilization to assist the healing process so you can't move that joint to let it heal. Anti-inflammatory and pain medications such as ibuprofen. This just helps interfere chemicals to relieve pain. Severe cases may require surgery to realign bones or nailing, putting pins in bones to hold them in place. Duration of treatment, well, it depends on the age of the performer. So young performers, such as teenagers, children, it only takes several weeks to repair, whereas elderly performers take several months because their bones are more brittle and they're weaker. Next, stress fracture. What is it? Well, it's a tiny crack in the bone surface, so you might not realise you have it. Signs and symptoms, not a lot. It's just as you only really know if you have it as throughout the duration of the performance, the pain gets worse and worse. Kind of cause for this is obviously overtraining, intensity overload, inappropriate equipment, and also unfamiliar surfaces. So playing sunny and clay instead of a hardcourt tennis. Treatment of a stress fracture. Well, in most cases, medical attention will be required for diagnosis, as you may not realise you have it. Price principle again, which is swelling. This is the key point. Rest for around 2 weeks, and for a further 8 weeks, avoid any activity. This is to prevent another more complex stress fracture. Immobilization used again, such as splint or crutches, and then a gentle return to exercise accompanied by physiotherapy help, such as posture and alignment. So duration of treatment can take a significant amount of time if not treated properly, and obviously if it is rushed can lead to a worse secondary injury. Right, next one. Dislocation. This is displacement of one bone from another from their original positions, such as the shoulder and the shoulder joint. Signs and symptoms pretty obvious here: severe pain, loss of movement, deformity, swelling, and a pop feeling. Potential causes: an excessive impact force from a collision or fall, such as a rugby tackle or a slide tackle in football. Treatment of this is obviously immediate medical attention, and in severe cases an ambulance may be used. Immobilization using a splint or sling to hold the joint in place. No attempt to reposition bones unless by a medical professional. Price principle used again. Anti-inflammatory and pain medication, as this is also a very painful injury. And also some dislocations, once it's happened once, the tendons can become weaker, so it may keep reoccurring, and this is when surgery would be used to stop this. Duration of treatment, it just depends on the severity of it, so there's no really specific time length. Sprain, we all had these across your sporting lives. Well, damage to the ligaments that connect bone to bone, so kind of you just normal pain and swelling around the area, possibly a discoloration such as bruising, and an inability to bear weight, so being able to hold your weight on that particular area. Potential causes, well, this is from a sudden twist, impact or fall that forces the joint beyond its extreme range of motion. So sudden change direction in basketball may cause a sprain of the ankle. Treatment of this, medical attention only really used in severe cases. The Price principle is used to reduce swelling. Drugs such as anti-inflammatories can be used to reduce the pain, and functional rehabilitation, strengthening mobility and balance exercises. Duration of treatment, several weeks to several months depending on the severity, and surgery will only take place if the non-surgical treatments have failed to respond. Last, but one more actually, sorry. Torn cartilage, well, this is a tear in the articular or fibro cartilage within a joint. Common one is the meniscus of the knee. Signs and symptoms is associated damage to the ligaments, which causes pain and swelling. Also a clunking or a popping sensation and locking of the knee. Potential cause of this is a sudden twist, impact or fall, similar to dislocation, torn ligaments and dislocation. So the treatment of this, only different one compared to others is hydrotherapy can use to maintain fitness, and it's quite a hard one to explain. Pronounce arthroscopy, surgery in persistent cases to remove flaps or jagged sections. Duration recovery can be slow. Athletes can restart 2 months post-surgery. Last one, exercise-induced muscle damage. What is it? It's a microscopic injury to the muscle fibers, so we'd all have experienced these in our lifetime. So signs, pain and swelling, a bit of tenderness around the site, and the strength peaking between day to 3 days after exercise. Potential cause, excessive eccentric exercise, such as the downwards phase with a bench press. Treatment of this, there's no actual research to say that any methods that treating the muscle damage can be effective, but there are several techniques you can use to reduce DOMS, which is delayed onset muscle soreness, such as cold therapy, so an ice pack after you've exercised to reduce swelling, massage and stretching techniques. But medical attention should be sought if there's heavy swelling or dark urine, as this means there's damage to the kidneys. Duration of treatment is about 5 days to fully recover from this. Thank you very much, guys. See you soon.